Thank you, Beth. Now I'd like to introduce the hard act to follow. Dan Shapiro is an Arnold P. Gold Foundation Professor of Medical Humanism and the Chair of the Department of Humanities at Penn State College of Medicine. Dr. Shapiro earned his Ph.D. in clinical psychology at the University of Florida and went on to Harvard Medical School, where he completed an internship and an endowed postdoctoral fellowship focused on counseling approaches with medical patients. He was on the faculty here at the University of Arizona for 13 years, where he won teaching awards for his work with residents, interns, and medical students, and they all miss him dearly. Dr. Shapiro has written 2 books, Mom's Marijuana, about his personal cancer experience, and a second memoir, Delivering Dr. Amelia, which focused on his psychological treatment of a physician. Both books are in wide use at universities and colleges and are required reading at a number of medical schools. His writings about the patient experience and physician-patient relationships have been featured in the New York Times, JAMA, Health Affairs, and Academic Medicine, and he is a regular weekly consultant to the hit television shows Grey's Anatomy and Private Practice. Dr. Shapiro told me that he misses Arizona greatly and misses Tucson, so please help me in welcoming Dr. Shapiro.
I want to start by telling all the Grey's Anatomy fans exactly what happens to Izzy. No, I'm not going to do that. I'm afraid that I was invited to do this not because of my oratory skills, but more because I talk really fast. So let's start here. My mother was diagnosed with pretty far advanced lung cancer the year before you started medical school. She lived 6 months longer than anyone, including me, thought she would. She traveled with my father to Greece and to Cuba and had a chance to dip her toes in tannin-stained lake water and watched her grandchildren giggle and quarrel and giggle in roughly that order before the disease overtook her. I got to Hartford in time, rushing to her room the night before she died. I told her she'd been a great mom, and I know she was lucid then because she looked at me and said, "You were a great son. A pain in the butt sometimes." Only she didn't use that word. And we embraced. After that, she was never conscious again. She died the next morning with us there in the room with her. In the hours after, my father, my brother, and I sat in her hospital room on the palliative care unit. The staff allowed us to stay in the room with her body for 5 hours, and we took turns crying or just sitting quietly. I remember water dripping in the sink, and outside her 5th floor window, a massive smokestack blew steam over Hartford's dreary late winter landscape. And during an organized moment, my father telephoned the local medical school's willed body program and left a message that my mother's body was ready. As I listened to my father's controlled words, I had a visceral response. I hadn't realized my mother was donating her body to the medical school. I taught here at the time, and have always viewed the gross anatomy lab strictly from the faculty perspective. Occasionally, as you, our students, struggled with the intimacy of death, I considered your perspective, but I'd never considered that my own mother might become a donor, and a sudden flood of trepidation overtook me. I nearly begged my father, not to send her. I didn't want her body to reside, naked, under a plastic tarp in a cold room dominated by the hum of heavy fans and the smell of formaldehyde. I didn't want her to be called cadaver. I didn't want her name replaced by a table number, nor her body touched intimately by anyone who didn't know her. My mother died at the age of only 68 years, and in that moment I felt the sting of having been robbed. After all, we, my father, my brother, and I, had lost our chance to touch her. Why should anyone else have that privilege? I had more rational protests, too. I mean, I've been around the lab. I know that you folks frequently fail to dissect cleanly and inevitably get confused over the many byways and highways, superiors, dorsals, proximals, and inferiors that map human anatomy. Over time, you forget the majority of those anatomical structures. And as I sat with her body, this thought bothered me. What was the point? Why subject my mother's body to the insults of sloppy dissection? And what about Mom? My mother was a modest woman. Though diminutive, little, she struggled occasionally with her weight. There were parts of her body that irritated her, and those she worked to cover over or to change. The idea of laying naked on a steel table beneath bright lights could not have appealed to her. How could she possibly have made that choice? My mother also feared the anonymity of medical environments. I once accompanied her to radiation treatment, and she smiled when the valet at the hospital called her by name, and then did the clerks and the nurses and the physician. As we hunkered down beneath the bulletin board advertising Reiki treatments and support groups, she whispered in her failing voice, "I never feel like just another person here. That's really important." But she knew she would be anonymous if she donated her body. It could not have been easy for her. And I sat there thinking about her decision. More than anything, what my mother wanted from physicians was dedication and humanism. She would have celebrated you when you held that small pump, her heart, in your hands. She would have laughed as you noted the elaborate pathways of her veins and plucked the tendons lifting her fingers. And she would have nodded when you saw the vast distance her disease had spread, from the right lobe of her lung to her pancreas and then up and down her spine. She would have whispered, "Study me hard, and come back to me again and again. You learn everything there is to learn from my body, so that someday you can do something about these dreadful diseases." And then she'd have looked at you straight on with those unflinching blue eyes.